So let's take a tour around Rich Constantine's office, see what he's got going on. You built this place 3 years ago?
Yes.
Did you buy it and build it, or what's the deal?
We bought the lot and we built it.
Ground up.
Ground up.
How long did it take you to get there?
15 months.
15 months from the day you said, hey, I'm interested in doing this.
Yes.
Wow.
Yeah.
And you look back and say, I would have done so many things differently, or you look back and say, I'm really, really super happy with it?
A little of both.
A little bit of both.
Yeah.
I was going to call you out if you're lying to me. You know? So let's show us around. What you got going on here?
Patient walks in, what do they get?
Patient walks in. Well, first you'll notice, this is something you notice on the way out, but we got a no cavity bell here. So if you're excited about having no cavities on your way out, give it a ring.
Oh, snap.
Hopefully not too hard because...
Is that when the wrestling match between me and you starts?
Yeah, let's go. Another thing that we have right here, which has been huge for a lot of our patient pictures that we take to post on social media, is the logo. It goes a long way in helping people know where the picture was taken.
Simple.
Branding.
Yeah.
Simple branding, though.
We have a consultation room here for
Oh, gosh.
patients that
That's great. This really is good.
we want to spend a little extra time with, going over procedures and phases with them.
Do you bring your new patients here before? Like, do you kind of do like a tell me about yourself, what brought you here, or they get brought back immediately?
They get brought back immediately. We use this primarily for bigger cases or for second visits where the first visit wasn't enough time to go over options.
So you're planning out and going over with them on the board. Cool,
Yeah.
cool.
Yep.
Nice. All right.
All my receipts, my educational receipts
You
are
look
on
very...
the wall.
Are those online areas?
Yeah.
I don't know about you, but I print those out. What I do is I take the articles that everybody else writes, and then I put my name. I don't even change the name. I just put my picture on it, and then have it laminated.
Nobody reads it.
Nobody reads those things.
You do that with technology these days.
Perfect.
So in this room here, we have the XG 3D CT machine that we use primarily for evaluating patients.
Every patient gets one?
No.
No, you're lucky I didn't go on to you about that.
Buddy, why not? What's your new patient exam from X-ray standpoint?
Either FMX or PAN.
Oh, dude, stop that.
Wow.
CT on everyone.
CT.
Start
CT
Monday.
and 7.
4 bite wings and a CT.
Start on Monday.
And 7 intraoral X-rays.
Okay.
4 posterior bite wings, 2 upper anteriors, 1 lower anterior, and a cone beam.
Start on Monday.
Yeah.
Tell the audience
Change your
why.
life.
So what the reason?
freaking out.
So we changed. We used to do a Panorex and 4 bite wings, or a full mouth series, and then we switched to a cone beam on quote unquote every patient, meaning 95% of our patients, and 7 intraoral X-rays. The 7 intraoral X-rays are all about seeing decay, all this periapical pathology, all the sinus pathology, all of those things you'll see on the cone beam. And the other reason the main reason I want to take the cone beam on everybody is right now you're doing it for those that express interest in implants. I want to do it for those that don't even know that they could have implants. And what happens then in hygiene is now you're going to tell your hygienist in the middle of an appointment to go now get a cone beam, and that's an extra 10 minutes that now you're going to have to come back to the operatory. So to me, nip it in the bud, get that X-ray, and it's so diagnostic. I mean, 40-50% of your X-rays will find some type of diagnostic issue going on.
Do you send them out for
A reading?
radiology?
No.
reading?
So your ethical and legal obligation is to review every scan that you take, and scans that you're unsure or not worried about a finding of some sort. You have one of 2 options. One, you can punt that to an oral surgeon to let them take a closer look, or you can send it to an oral-maxillofacial radiologist to have reading. And somewhere in the 1-2% ballpark, so 1 or 2 out of 100 is what you'll send out for a professional
And that's
reading.
what we do. We'll tell her, hey, our patients, this kind of looks a little finicky. I'm not sure what this is. I'd like to get it sent off. It costs $100. Would you mind? I'm not making anything off that. Would you mind paying? And I've never had somebody say no.
As far as billing of the CT,
So bill it out as a Panorex.
Okay.
And one of the things we can have Hutan talk to us about at dinner is billing it out through medical for the CT component.
But you're going to find there's so much dentistry that you're missing.
It's irrelevant. Just bill it as a Panorex, make your life easy. Don't tell your team members to change anything. Call it a day. Okay. Change that Monday.
Your life.
Change that Monday.
Good.
I want to know about the chicken because I'm already looking in your drawers and things.
we did a little video about how we have to treat chickens sometimes, and so you go to my Instagram page. Do you have Instagram? Yeah.
Let's go!
By the way, just so you know, I'm no Rich Constantine, but I got got 1,400 followers. Okay, in a matter of a month and a half, I'm doing all right.
You keep wearing that belt, you'll get more a lot quicker.
You better, dude. I'm not. The belt's gonna get me the women. What you talking about?
But yeah, that's what the chicken was for.
So this is the sterilization.
I love how this.
I love this open sterile
Yeah,
area.
I thought
This is
I
great.
literally thought this was a kitchen when I walked by it for the first time.
Well, you can have wine and cheese after you get done sterilizing.
Well, it really forces the team to keep everything clean and organized, which is great.
Yeah.
But then patients see that too, and they've got to be like, "Oh wow, everything's like super clean," and it puts that thought out of their mind.
Do you ever walk
entirely.
back here and there's like a bunch of scattered? You're like, oh gosh.
When the Patterson shipments come in, that's why we created a little cubby on the other side of that wall. But they know when I start twitching, like
Get that cleaned up. Get that
Yeah.
cleaned up.
So sterilization, all of our operatories are equipped almost identical so that we can do treatment if we need to.
That's
in the room.
huge, by the way.
So
you can do that quick filling and hygiene or
Yeah.
whatever it may be.
I love you got nothing on the chairs.
Yeah, nothing on the chairs. Try to keep anxiety level down for the patients. That's kind of why we went with rear delivery, so that all they see when they come in is the chair.
Yeah.
Chair and screen.
All but my
Super
first
clean.
my first two operatories are my first three operatories are primarily hygiene. These first two only have one ingress egress, but every other has double. Just helps with efficiency of the office.
Dancing dentist.
Yeah, it is.
T-Bone's going all European on us, and he's trying to do only one
door.
One door.
One door.
Yeah, I'm going to one door.
You remodeling?
Yeah. I got to keep up with you, Rich. My wife already texted me. His office is beautiful.
Yeah, she did say
So
that.
I mean, I'm like, are you kidding me?
you had asked me about regrets. I wish I built a bigger lab space.
want a bigger lab. Always.
The upstairs, I have some unfinished space. That might be an option in the future.
lab in our office.
Oh, really?
We moved it upstairs.
I might need to talk to you about how you made that work.
Well, we have our training center up there. We can take a peek. But see, my thing was all these model trimmers and things are so loud.
Yeah.
You know, and this produces dust and stuff. And quite frankly, this could be your office or another storage room and things like that.
Where'd you go undergrad?
Ohio University.
That's where you played football. Did
Yeah.
you? Haven't you stalked him enough, Aaron?
No.
We added these doors to the last operatories for some of the longer procedures that patients might want a little more privacy.
Yeah.
That has helped out.
You know
a
what's
lot.
interesting? When I came out of school, there was this thing where you're doing these open bays where there were no walls in between the operatories. I think even with having two doors, it was so loud that we went to one door, and I still think it's loud. I still want to go to the next step of totally closing off the operatories. I like how you did the barn door here.
Yeah.
I think this could be something that we could add into some of our operatories at our office.
Yeah.
But it's beautiful,
Love
man.
It cuts
barn
down
door.
a lot of the noise
Yeah, the
more
noise
than
is
more
too
than you
much.
would think. Yeah. So yeah, like I said, all the operatories are similar.
Come see the window. This is cool.
Yeah.
This was smart.
we like
yeah.
the window viewing window.
What is
That's
that
slick.
viewing?
The CERAC viewing window.
C-Rack challenge.
I need to. I'm trying to find like a decal that I can put on there, like a CERAC
Oh,
decal
yeah, 3D.
or 3D.
Yeah, we'll get you a 3D dentist one. Come on, man. What you talking about, Willis? So you use Isolite as well?
For some, yeah.
Yeah, it's a great product. I love this thing.
Yeah.
We have it in all our operatories, including hygiene. Everywhere.
Must have.
Must have. And then, so your CERAC machine. So which room do you work out of?
I work out of these
The mouthwash?
these two. This is Dr. Glimp's primary operatory.
How come he only has one and you got two?
That's what he wanted.
Why don't you have one and him have two? Come on, Rich.
I'm a jerk. That's why.
I'm messing with you, dude. You love your CERAC machine?
I do.
Yeah. That's awesome. I don't know how people work without all. And what's amazing is your opportunity with this thing is unbelievable. You know, implant guides, sleep appliances, all that stuff is really within reach. Ortho. I mean, you have all the technology to do it. So
Don't mind me.
Hypnotic is what it is.
Oh yes. I like
So this
I like
back
seeing this
room
too.
was initially going to be a laundry. Check out what Dr. Glimpf did to it. I can't believe he fit all this in here. It's our little stain and glaze center.
Get out of here.
with the oven and everything.
Awesome. That's perfect.
He loves
bonus
it.
with
He
him.
goes to town in there.
No way.
It's awesome.
This is incredible.
Wait.
And close the
Who
door
does
on
this?
himself.
Dr. Glim.
Hey, hold on. Move in a little bit.
Oh God, I don't like tight spaces.
All right, let's go out of here.
Yeah, it's supposed to be a laundry room.
And this is your
uh,
office?
Yeah, that's my office.
Oh, dude, what is this up on the ceiling?
It's a little hang and stretch.
Oh, let's see this thing.
We'll pull apart. Oh wait.
Competition, let's go.
All right.
Is it rated for you?
Yeah, you're good, man.
Oh, you're gonna push me up? All right, your turn.
I got a try.
Johnny P. That's cheating.
Hey, you can't go underhand.
You gotta go overhand, dude.
Can you do?
Why can't I do it?
Now your turn.
Come on, Sully.
Let's see if we can do.
Whoa, I think I'm.
I know, he'll be able to do like four.
Hold on.
Wait, Rich has got to do one.
Careful.
All right, whatever.
All right, Rich.
You chipped my belt with the. You chipped my desk with the belt, man.
One-handed like Rich, like Sully did.
Oh, I don't know if I can do that, man. I'm a little heavy.
Oh yeah!
Look at that, dude. Come on.
But hey, I forgot to show you. This is I built my whole office around this room right here, having my own bathroom.
It's you know what though? It's the little things in life that are like
Dude, the
super
only
important.
thing you're missing though is a bidet.
Oh, the bidet.
Toilet.
Dude,
Like, he got me
if
on
you
it.
ever come, when you
Yeah.
come to our class,
Oh
you
my
come
gosh.
stay at the house.
Yeah.
The bidet is unreal.
I
dude.
literally, we're right at your house.
By the way, let me tell you, of all the things you have in your office, this is the most important piece of technology you have. A dental camera. To take pictures of your patients. It's unbelievable how much dentistry this thing will go with.
Do you do that on every new patient?
I have one in every room.
Oh.
We have one on every operatory.
And you're.
My hygienists use it,
And
my
SLR,
assistants use it.
right?
We have that, something just like that on every room.
Wow.
We don't have intraoral cameras
How
or anything.
long for new patient exam?
Hour and a half.
And they get the pictures that
Pictures. Our new patient exam includes pictures, cone beam, an iTero scan, everything in new patient
They do
exam.
the iTero because of the Invisalign
Invisalign
software that
to
can-
be able to see the immediate clean
virtuals.
check.
Yeah.
Wow.
Yeah.
Wow.
Photo should take
He doesn't.
4 or 5 minutes max.
So he obviously loves Sarek and has the iTero
Yeah.
because of that.
I just want the clean check. It's
Yeah.
it's increased our case acceptance pretty significantly.
So yeah, guys, that's
a
it.
beautiful office.
Let me show you upstairs just to
Yeah,
show you
let's do it.
that space.
Wow. Sir.
So this is the unfinished space.
Who needs to work
to-
that when you can walk up and down these stairs?
But I just hate that I built the kitchen here. Then, because like if we do anything else in here, you got to walk through the kitchen. You know,
You move the kitchen though.
move the kitchen.
Who the hell needs a kitchen, dude?
I'm so jealous of that space.
Move the kitchen there.
I literally pulled a muscle.
You hit the thing hard.
Dude, it's Christmas time.
Lab up here.
This is where Dr. Glim's office is, but I mean, we could make it whatever. I didn't want my office up here just because I don't like being.
Put him in the lab. And
I wouldn't want to have to climb up and down the stairs all day long.
The question is, can you get another op in your office?
Oh yeah, we're just gonna mess with the hours, so.
Oh yeah, that's right. My bad. We're just gonna double our practice sizes by and just adding a couple hours here and there.
We're not double practice size. We're doubling.
Work lunch on Monday.
We'll just work every day through lunch. Should be fine.
We're gonna double revenue.
Howard.
Yeah.
Sully, he's gonna throw you down the stairs. You're gonna throw Sully down the stairs. Oh
Half the
yeah.
staff works and they work through the weekend, and like you only get every other weekend pretty much.
Well, it's a consumer base.
I don't want to divide my team.
You have to figure out a way to do that flexes and you overlap more, but then it's the same thing. It's fun to work when other doctors here, you know, you start to kind of.
But it doesn't have to be every day. It can be one day. It can be one morning. It can be, any number of things.
And his point to me, which I get, is just try it. Just pick one day where.
The best thing that could happen is you could do it. You're like, holy smokes, we can fill that. We really do need a bigger building. And then you don't have that fear of building a bigger building because you're doing the revenue here.
Because what are your hours right now?
10 to 7 on Mondays, and then every other day it's 8 to 4.
Let's go
Through Friday?
Every other Friday we work 7 to 11, 7 to 12.
Sully, he works every other Friday.
So okay, let's go get some. Let's get out of here
All right, man.
before I get told any more.